everyone, welcome to this episode of our science video. I am Xu Shuifei from Shuguang Hospital, affiliated with Shanghai University of Traditional Chinese Medicine. Today we are going to explore an important branch in the process of cardiovascular diseases, cardio-oncology. Let me start by telling you a story. Aunt Lee, a 50-year-old breast cancer patient during her chemotherapy sessions after courses, always felt palpitations and shortness of breath. Even slight physical activity left her very breathless, and she often woke up at night feeling suffocated. At first, she thought it was a normal reaction to chemotherapy and didn't pay much attention, but the symptoms became increasingly severe. When she went to the hospital for a checkup, it turned out that her heart function had significantly declined. She was diagnosed with cardiotoxicity caused by chemotherapy drugs, which is what we are discussing today, cardio-oncology. Patients like Aunt Lee, who develop heart diseases due to cancer treatment, are not uncommon. According to statistics, a significant portion of patients undergoing cancer treatments, such as chemotherapy and radiotherapy, experience varying degrees of cardiovascular complications. So what exactly is cardio-oncology? In simple terms, cardio-oncology refers to the cardiac dysfunction and cardiovascular complications that occur in cancer patients during the onset, progression, and treatment of the disease. Its causes are complex and varied. On one hand, the tumor itself can release substances that affect the normal function of the heart. For example, certain cytokines secreted by tumor cells can interfere with the heart's electrophysiological activity, leading to arrhythmias. On the other hand, cancer treatment methods can also inadvertently harm the heart. Among chemotherapy drugs, anthracyclines for instance, can effectively kill tumor cells, but they accumulate in myocardial cells, damaging the myocardium, leading to decreased myocardial contractility and causing heart failure. Radiation therapy can damage the heart's blood vessels, resulting in insufficient blood supply to the myocardium. Additionally, cancer patients are often older and may already have risk factors for cardiovascular diseases, such as hypertension and hyperlipidemia. These factors interact with each other, further increasing the risk of developing cancer-related heart disease. The symptoms of cancer-related heart disease are varied, with common ones including symptoms of heart failure such as shortness of breath, fatigue, and edema. As mentioned earlier with Aunt Lee, her exercise tolerance decreased and she developed edema in her lower limbs. Symptoms of arrhythmia include palpitations, a feeling of heart fluttering, and irregular heartbeats that can be fast or slow. There are also symptoms of myocardial ischemia, which manifest as chest pain and chest tightness, and some patients may experience dizziness or fainting. These symptoms are sometimes atypical and can easily be confused with the symptoms of the tumor itself or other diseases, so they are often overlooked or misdiagnosed. In terms of diagnosis, doctors usually employ a variety of methods, starting with a detailed inquiry into the patient's medical history, understanding their cancer treatment, and checking for any family history of cardiovascular diseases. Then, a comprehensive physical examination is conducted with a focus on cardiac auscultation to check for any abnormal heart sounds or murmurs. Subsequently, a series of auxiliary tests are utilized, such as a cardiac ultrasound, which can visually assess abnormalities in the heart structure and function, determine if the myocardium is damaged, and check whether the heart valves are normal. An electrocardiogram, ECG, can immediately detect issues related to arrhythmias. Additionally, blood tests for cardiac injury markers, such as troponin, BMP, and anti-pro-BMP, if elevated, indicate myocardial damage. Once tumor-related heart disease is indicated, treatment becomes urgent. The treatment principle is to control the tumor while maximizing the protection of heart function. For patients with heart failure, certain medications are used to improve the heart's contraction and relaxation functions, such as diuretics to help reduce edema, angiotensin-converting enzyme inhibitors, or beta blockers to improve myocardial remodeling. Patients with arrhythmias may use antiarrhythmic drugs or undergo procedures, such as cardioversion or catheter ablation, depending on the type. For patients with myocardial ischemia, it may be necessary to undergo coronary intervention and bypass surgery. At the same time, the patient's cancer treatment plan may be adjusted based on their specific condition, such as reducing the chemotherapy drugs or changing the type of chemotherapy drugs, and the dosage range may also be adjusted. Cardio-oncology is a branch of cardiology that requires our high attention. During the cardiac treatment process for cancer patients, we need to regularly check the heart, promptly identify any issues, and then address them. I hope today's science popularization can help everyone gain a deeper understanding of cardio-oncology and draw attention to it. Alright, see you in the next episode.